right. All right, before I begin today, I just want to thank some of our partners that are standing up here alongside me. Some of our councilwomen have joined us as well. We have Councilwoman Lavette Fuller. We have Councilwoman Tabitha Taylor that stepped up. But to our partners in this endeavor, LSU Health Shreveport's Chancellor, Dr. David Lewis is here with us, and also Dr. James Patterson, who is the Chair of Psychiatry and Behavioral Medicine. And I really, really want to thank Police Chief Wayne Smith, who has been the captain of this initiative as well on the Shreveport side. More and more, our citizens here are dealing with serious mental health issues. This is a growing issue in Northwest Louisiana, and the pandemic only amplified it. This partnership between the City of Shreveport and LSU Health will provide support and resources to our first responders and our most vulnerable citizens. Our objective is to improve public safety and focus our law enforcement resources in the areas they are most needed. We will be working alongside the Shreveport Police Department to develop an action plan to improve the crisis response system in Shreveport. A focused approach will improve 911 responses involving individuals suffering from mental illness. This will be an added layer on initiatives that have already been implemented by the city. We are requiring first responders to complete a 40-hour crisis intervention training course. Community development is also working with mental health programs to provide support to the public. The City of Shreveport will continue administering critical resources, and hopefully, together, we can make a real impact in our community. Next up, I'm going to invite Chancellor Lewis to make a couple remarks. Chancellor.
Thank you, Mayor Perkins. What a great day this is. Anytime we can organize and take on new responsibilities and really take ownership of this. You know, mental health has become a crisis nationwide. And as the mayor mentioned, since COVID, we've seen a dramatic increase to the point that the CDC has called this a national crisis. And quite honestly, in Shreveport, we already had pretty much a crisis, but it's gotten a whole lot worse since the pandemic's been over. And us coming together can do nothing but help the citizens of Northwest Louisiana, and that's ultimately what it's all about. So I'm just happy and proud to be involved in this. I know that Dr. Patterson, the chair of psychiatry at our institution, is going to give you some specific data about how significant this problem is in our particular area. So thank you all for being here, and thank you all for your interest.
Good afternoon. My name is James Patterson. I am the chair of the Department of Psychiatry and Behavioral Medicine. More importantly than that, though, I'm also the director of emergency psychiatry for Ochsner LSU. It's a position I've been doing on and off for the past 20 years. And over the past 25 years, we've noticed something that is very important, very worrisome, very problematic. The population of Shreveport, Catawba, has actually gone down about 2% over the past 20, 25 years. However, the number of patients coming into our emergency rooms has increased almost an order of magnitude, almost 1,000% in the past 25 years, about 500% of that in the past 15 years. So think about that. It's not more people, it's more sick people. So why is that? It has to do with something that I call the model of care. The model of care we have right now is simply broken. It's not working. And that's one of the goals of this Crisis Response Coalition, is to look at the model of care that we have and fix it so that we're able to take care of our citizens in our community more so than we are now. We have to do something because those numbers are still going up. And so we are working with the city of Shreveport, specifically with the police. The real heroes here are sitting in that back corner over there. If y'all want to turn your cameras and take a picture of them. Those are the folks who help us. Right now, our two places that we take patients are the ER or jail. And that's not really a great way of doing things. So we're trying to fix that, and this system is designed to do just that. So thank y'all very much.
Well, good afternoon. Let me thank our partners at LSU for all the help that you provide to our city, not only in our mental health needs, but in all of our medical needs. I was born there, so thank you all very much for bringing me this far, whoever you were. Over the course of time, as I said, SPD, when someone calls us for help, no matter what that need is, SPD will respond and do the best we can with what we have to work with. Thus far, this year, 2022, since January 1, the Shreveport Police Department has responded to 1,691 calls for services where the initial call came in, or when we got on the scene, we recognized that there was someone going through a crisis, a mental crisis in their life. And the challenge becomes hard for us at that point. Which direction do we go? Either the person goes to jail, as Dr. Patterson says, or else they come to LSU for some mental health assistance. With 1,691 responses, obvious medical concerns, a great deal of the Shreveport Police Department officers' times are spent on calls that some of them can be directed somewhere else beside jail or beside law enforcement concerns. On the average, a call of that nature can take anywhere from 30 minutes to 6 hours out of an officer's day of their time trying to assist someone where they could be better assisted somewhere else. So I'm so happy that this initiative is unfolding. Progress is being made. Thus far, in excess of 150 Shreveport police officers have been given additional training, CIT training, in how to recognize and how to deal with people who may be going through mental health crisis. And we look forward in the future to expanding that to where every police officer has that training, and that there are some other options for us to use in helping to help people in our community. We're looking forward to the day when we can have people who specialize with medical training in the mental health arena to respond with us on call, or we can send them to a call instead of SPD officers having to respond. But there's a lot of data left for us to analyze in cooperation with all our area partners and figure out which is the best way to go, the best model to use for Shreveport. And in ending, let me say that Shreveport is a great community with wonderful people that live here, wonderful area partners. Shreveport is a grand community because in time of need, everyone come together with one objective, which is to make our community a much better community for all of us. So thank you very much.
Good afternoon. I'm Laura Alderman. I work with Dr. Patterson at LSU Health here in Shreveport, and I want to open the floor for any questions that you all may have for any of our speakers that have spoken today.
Well, Chief Smith just mentioned that eventually you guys want to get to the point where you guys can have people that are designated for these calls. So what is concretely going to be changing immediately aside from that training?
Well, the ones that thus far have received the training, when a call comes in and we recognize it at that point is possibly being a mental health concern, the call gets redirected to an officer that has this specialized training. And we're hoping in the future not only to direct the call to the officer with the specialized training, but also other partners within what we're able to develop, medical professional clinicians who can go in and lead the charge and hopefully get the person the help that they need instead of SPD officers having to take them to jail or take them to the hospital where they sit, they tie up a lot of time waiting on a physician to see them.
other questions? I want to thank some of our other partners who you will not be hearing from today, but who were very present in the development of this action plan. Our coroner's office, Dr. Toma, could not be here today. He's actually at the hospital but wanted to be. Our Caddo Juvenile Services representatives, Clay Walker, Judge David Matlock, Caddo 911, Shreveport Fire Department. All of our first responders are working together from many sectors in this community to solve a problem that's very costly. Costly to our first responders, costly to our public health care systems, and costly to the individuals who might have an opportunity for a less intensive and less expensive and more effective type of treatment. So we look forward to seeing that accomplished.